Hello, this is your host with the No One best-selling health channel in the world. Today, as episode, we going to talk about miracle vitamin that can stop proteinuria overnight and fast-track your kidney repair. Now, if you are new here, you may ask, who am I? Well, I'm a doctor of physical therapy. And I have been talking about natural ways to get rid of kidney disease for over 20 years. So if you like this kind of information, please make sure to subscribe to this channel. Alright, so today we're going to talk about one of the most common symptoms of kidney damage, that is protein in the urine. Now, protein in the urine, or what we call proteinuria, is a condition where there is more protein in the urine than normal. But the question is, why does it happen? Well, it happens when the kidneys are damaged and they start leaking protein into the urine. Because remember, the function of the kidneys is to filter the blood and remove waste and extra fluid as urine. But when they get sick, certain things can pass through the urine that normally should stay in the body, like glucose, protein, and red blood cells. Now, many people with kidney disease often experience proteinuria, and it can be one of the first signs of kidney damage before symptoms become apparent. So today I'm going to talk about the causes of proteinuria, symptoms, and how to prevent it from getting worse. And also, I will share with you the top 3 vitamins that can help reduce protein in the urine naturally. So let's jump right in. The first cause of protein in the urine is diabetes. So type 1 and type 2 diabetes are actually autoimmune diseases. And both types involve the destruction of insulin-producing cells in the pancreas called beta cells. Now, since the beta cells are destroyed, the body cannot produce insulin anymore, and the level of sugar in the blood will rise. And when the kidneys try to filter out this excess sugar, they get overloaded and start leaking protein into the urine. This type of proteinuria is called diabetic nephropathy, and it is one of the leading causes of end-stage renal disease and kidney failure. So if you have diabetes, it is very important to control your blood sugar levels. Second cause of proteinuria is high blood pressure. High blood pressure or hypertension is another major cause of proteinuria. So when the blood pressure is high, it puts a lot of strain on the kidneys, and the blood vessels in the kidneys get damaged and start leaking protein into the urine. Also, high blood pressure can cause diabetes because when the blood pressure is high, the body releases a hormone called angiotensin II, which stimulates the thirst mechanism and raises the blood pressure even further. It also increases insulin resistance by blocking insulin receptors so that cells cut and take up glucose from the blood. So this leads to hyperglycemia, and then the kidneys get overloaded with excess sugar and protein. So again, it is important to keep your blood pressure under control by eating healthy foods, exercising regularly, and managing stress. Third cause is glomerulonephritis. Now, glomerulonephritis is inflammation of the tiny filters in the kidneys called glomeruli. It is usually caused by an autoimmune reaction where the body's immune system attacks its own kidney tissue by mistake. And it can also be caused by infections with bacteria, viruses, or other pathogens such as hepatitis B or C, HIV, etc. The symptoms of glomerulonephritis include blood or protein in the urine, swelling in the feet or ankles, high blood pressure, and decreased kidney function. Treatment for this condition includes medications to suppress the immune system, antibiotics, or antiviral drugs depending on the underlying cause. Fourth cause is multiple myeloma. Multiple myeloma is a cancer of plasma cells, which are a type of white blood cell. So when these cells become cancerous, they multiply rapidly and release abnormal antibodies into the blood. These antibodies cause inflammation and damage to the kidneys, and they start leaking protein into the urine. Now, the symptoms of multiple myeloma include bone pain, fatigue, weight loss, high calcium in the blood, and anemia. Treatment options for multiple myeloma include chemotherapy, radiation therapy, and stem cell transplantation. Fifth cause is liver cirrhosis. Liver cirrhosis is a late stage of scarring and damage to the liver caused by chronic hepatitis B or C infection, non-alcoholic fatty liver disease, etc. When the liver is damaged, it loses its ability to produce certain proteins that help maintain the blood volume and blood pressure. As a result, the kidneys get overloaded and start leaking protein into the urine. So again, it is important to protect your liver by avoiding alcohol, processed foods, and toxins, and getting regular checkups if you have chronic liver disease. Sixth cause is minimal change disease. Now, minimal change disease is a kidney disorder that causes the body to excrete too much protein in the urine. It is not clear what causes this condition, but it is thought to be an autoimmune or allergic reaction that affects the kidneys. The symptoms of minimal change disease include foamy urine, swelling in the feet or ankles, and a decrease in the amount of urine produced. Treatment for this condition includes corticosteroids or other immunosuppressive drugs. Seventh cause is acute nephritis. Acute nephritis is sudden inflammation of the kidneys that can cause proteinuria. It can be caused by a bacterial infection, viral infection, or by taking certain medications such as antibiotics or painkillers. The symptoms of acute nephritis include fever, chills, headache, nausea, vomiting, and changes in the amount or color of urine. Treatment for this condition includes antibiotics or antivirals, depending on the underlying cause. Eighth cause is chronic kidney disease. Chronic kidney disease is a gradual loss of kidney function over time. It can be caused by diabetes, high blood pressure, glomerulonephritis, or other chronic kidney diseases. As the kidneys get damaged, they start leaking protein into the urine. And when the kidneys reach the point where they cannot filter the blood properly, we call it end-stage renal disease, and patients need dialysis or a kidney transplant to survive. So if you have any risk factors for kidney disease, such as diabetes, high blood pressure, or a family history of kidney disease, it is important to get regular checkups and screenings to detect and manage your kidney disease early. Now, the good news is that there are some things you can do to reduce your risk of developing proteinuria or to help prevent it from getting worse. And I would like to share with you the top 3 vitamins that can help you with that. No, one is vitamin D. Vitamin D is actually a hormone that the body produces when the skin is exposed to sunlight. So our body needs vitamin D to absorb calcium and phosphorus and to keep the bones strong and healthy. But did you know that vitamin D also helps to regulate the immune system and reduce inflammation in the body? Yes, exactly. Inflammation is at the root of all chronic diseases, including kidney disease. So when there is inflammation in the body, it can damage the kidneys and cause proteinuria. So vitamin D has been shown to reduce inflammation in the body and protect the kidneys from damage, and it can help reduce protein in the urine. Studies have shown that people with low levels of vitamin D are at increased risk of developing kidney disease, and that low vitamin D levels are associated with worse kidney function and higher levels of protein in the urine. So to improve your vitamin D levels, you can spend more time outdoors in the sun, go for walks, hikes, or bike rides during the day. You can also consider taking a daily supplement of vitamin D3 at a dose of 10,000 IU per day after consulting with your doctor. Number 2 is vitamin E. Vitamin E is a fat-soluble vitamin that acts as a powerful antioxidant in the body. It helps to protect cells from damage caused by free radicals, which are unstable molecules that can harm the body's tissues. Free radicals are produced in the body as a natural byproduct of metabolism, but they can also come from exposure to environmental toxins such as air pollution, pesticides, herbicides, and chemicals. Exposure to these toxins can overwhelm the body's antioxidant defenses and lead to oxidative stress and inflammation, which can damage the kidneys and cause proteinuria. So vitamin E has been shown to reduce oxidative stress and inflammation in the body and protect the kidneys from damage. One study found that people with the highest vitamin E intake had a 60% lower risk of developing chronic kidney disease than those with the lowest intake. Another study found that giving vitamin E supplements to people with type 2 diabetes and kidney disease led to a significant reduction in protein in the urine. To increase your vitamin E intake, you can eat foods that are high in vitamin E, such as almonds, sunflower seeds, spinach, and avocado. You can also take a daily supplement of vitamin E at a dose of 300 milligrams per day after consulting with your doctor. No, 3 is NaCN acetylcarnosine. NaC is a powerful antioxidant that the body uses to make glutathione, which is another antioxidant that helps protect the body from free radical damage. In addition, NAC also helps to reduce inflammation in the body and support the detoxification process by helping the liver eliminate toxins from the body. It is also known as a precursor of carnosine, which is a natural compound that is found in high concentrations in the brain, heart, and other tissues. Carnosine is a powerful antioxidant that helps protect against cellular damage caused by oxidative stress and inflammation. So by reducing oxidative stress and inflammation, NAC can help protect the kidneys from damage and reduce protein in the urine. In fact, there are several studies that show that NAC can help improve kidney function and reduce protein in the urine in people with chronic kidney disease. So to improve your kidney health and reduce your risk of developing proteinuria, you can add these 3 vitamins into your daily routine. Just remember that it is always best to consult with your doctor before adding any new supplements to your diet. Thank you for watching today's video. I hope you find it useful and informative. Please don't forget to hit the like button, comment below, and share it with your friends and family. If you have any questions or comments, please feel free to leave them below. I'd love to hear from you. And if you haven't already, please subscribe to my channel so that you don't miss out on future videos. Wishing you all the best for your health and well-being. Stay happy and healthy.